This is a demonstration of just how easy it is to document a patient encounter inside of Athena 1 using DAX Copilot.
We are inside of the patient's chart. We have an appointment that's been scheduled and the patient has arrived. I'm going to come here to my phone and we will update the schedule by swiping down and the patient will appear on the phone. I tap to enter the visit. And as I get ready to go in the room, I can go ahead and turn my microphone on. Why, hello, Alessandra. They're telling me that you hurt your knee.
I did, yes. It's my left knee, and I hurt it about 4.5, maybe 5 weeks ago.
Okay, what were you doing?
I was snowboarding. I wasn't doing anything too exciting when I was snowboarding. I was just riding back down to the lift, and my board got stuck in the snow. So when I went to turn, my body did, my board didn't, and then I felt a pop in my left knee.
Okay, so you felt a pop when this happened. Okay. What did you do? Did you put ice on it? Did you elevate it? Did you wrap it? Did you do anything like that?
I did. I tried both of those, and elevating it, wrapping it with some ibuprofen definitely helped the swelling. And then I've kind of been alternating back and forth between ibuprofen and Tylenol, and it does help, but it definitely doesn't get rid of the pain by any means. But the swelling is pretty much down, especially from what it was like the first couple days after. But it's still pretty painful and it's still pretty unstable when I walk.
Okay. Have you hurt this knee in the past?
I have actually. I had ACL reconstruction in 2015, and it was on the same knee, on the left knee. And they did the patellar tendon graft, and I didn't have any issues with the recovery, with the rehab, anything like that. Everything was fine up until now.
Okay. All right. So you said you were snowboarding. Where were you?
I was in Park City.
Okay. You go there a lot?
I do. I try to. I haven't made it out there as much this winter as I like to, but anytime I can go, I try to. What about you? Do you ski? Do you snowboard?
I ski. I do not snowboard.
Nice.
Yep. And yeah, family and I, we like to go to Park City. Try to get out there about 2 or 3 times a season.
Nice.
So
I love it.
yeah. Well, let's go ahead and let's examine your knee. And so looking at your knee here, there is moderate swelling on the medial aspect of the left knee. There's no bruising present. When I touch your knee here, does that hurt at all?
Yes.
Yeah, okay. So there's some tenderness to palpation about the medial aspect of the knee. Now, when I pull on your knee like this, what I'm doing is this is called a Lockman test. You have a positive Lockman test on the left, and that's concerning for your ACL. So what that tells me is we want to take a closer look. Before I came in to see you, we did take X-rays, and the AP and lateral views of the left knee showed normal joint space, no fractures. So that's a good thing. You didn't damage the bony structure of your knee, but what we're concerned about is the soft tissue in there. And the best way to identify that and to examine that is by way of an MRI. So I'm wondering if you would entertain an MRI, getting that so we can see what's going on inside of your knee.
Yes, I think so.
Okay. All right. So what we'll do is we'll schedule the MRI, and I'd like you to schedule a follow-up appointment back with me a week after the MRI is done, because then we can discuss what to do. Because based upon the MRI results, that's going to tell us what's really going on inside the knee. And so whether just some medication and some physical therapy, or if we're looking at, actually another surgery for you. I can't tell you that until we get those results, but that will really determine our course of treatment. Okay?
That sounds good to me.
Okay. In the meantime, I am going to prescribe ibuprofen 800 milligrams. I want you to take that twice daily, and you'll be doing that for 2 weeks. And then what I want you to do is just modify your activity so that you restrict your activity due to any pain in the knee. So if something doesn't feel right, if something stresses the knee, makes it feel unstable or painful, just back off and don't do it. We don't want to damage the knee anymore, but it's not that you have to be sedentary and take all weight off the knee. Okay?
Okay, That sounds good.
All right. I'll talk to the folks up front. They will get the MRI scheduling going for you, and I'll see you probably here in a little over a week. Okay.
Deal. That sounds good. Thank you.
All right. Thank you. So when we finish the conversation with the patient, we go ahead and we turn the microphone off, hit this back button here. And what that does is that takes me out to my patient list that we were before. And when we get there, I see the patient's name and I have a little timer indicator. That tells me that that encounter is being processed. This is all real time. So I'm going to go ahead and swipe down. My results are already back. So now what I can do is I can just tap this button in the top right and then hit the bottom button, and my encounter is back to the EHR. So what we're going to do is we're going to go back into the EHR and take a look at what was done. So we'll go back into Alessandra's chart, and we will join the update. And as we look at this, you can see this is what's on the summary page. I'm going to go ahead and go actually into the exam itself so you can see which fields get populated and where everything goes. So here's the HPI. The patient presents for evaluation of left knee pain. And you can see everything was put in here. And when you take time and read this, you'll see we had a discussion of Park City. However, all it mentioned was she was snowboarding at Park City. Didn't talk about the fact that I like to ski. Didn't talk about the fact that I go to Park City. It only keeps things focused to what's the relevant conversation. The physical exam, it takes what we put as far as our physical exam findings that we spoke out loud. And then for the assessment and plan. So there's pain in the left knee, MRI will be scheduled, follow up a week after that. And the course treatment will be determined by the MRI results, talks about the ibuprofen and to modify our activities to avoid further injury to the knee. Patient instructions, it's listing out for her what needs to be done, attend the MRI, take the medication, modify our activity, and then those were the x-ray results that we discussed where it's breaking out those. It is that quick and easy, real time for things to go from Athena onto your phone, back into Athena.
That concludes our demonstration of the current functionality of DAX Copilot inside of Athena 1.